For our project, we decided to design an implant that could fix a lot of the problems with typical anterior cruciate ligament reconstructive surgeries. To start with some background, in the US alone, there are more than 100,000 ACL surgeries performed each year. The two main options are an autograft, which is a patellar tendon, hamstring, or quadricep taken from the patient themselves, but this has a second surgical site, so it results in increased surgical time, donor site morbidity, and altered site biomechanics, as well as an increased physical therapy regimen and increased prevalence of re-injury. The second most common option is the allograft, which is a patellar tendon, hamstring, or Achilles from a cadaver. However, this option results in a longer wait time to find a donor match, increased risk of tissue infection, and the possibility of tissue rejection. There's also a large financial burden placed on the patients. A study from 2005 to 2013 found the average insured patient paid almost $10,000 and $50,000 was billed before insurance. Our clinical need was to develop a solution to functionally regenerate the ACL to attempt to combat a lot of the negative aspects of typical ACL reconstructive surgeries.
To achieve our clinical need, we decided to make a ACL scaffold using the methods and fabrication listed on this slide, which I will walk you through. So first, we intend to obtain porcine or pig ACL from the stifle joint of the hind legs. This choice was made because of the anatomical similarities of porcine ACL to human, as seen in the figure to the right, as well as the biomechanical properties similarities, such as similar mean ultimate stress in the range of 32 to 36 megapascals. We would take this porcine ACL and decellularize it using a bioreactor system, as shown in the figure. We would use Triton X and SDS detergents to remove any pig cells from the ACL ligament. These specific choices are because they would remove the cells without affecting the collagen or the ECM structure, which we want to preserve. And we expect this to take a few days to a few weeks so that the patient can be prepared for their implantation surgery. Next, we would seed these scaffolds with human cells, specifically human dermal fibroblast cells that would be obtained from the patient's skin cells. And we would use the same bioreactor as earlier for this recellularization process. Finally, our seeded implant would be placed in the affected knee of the patient. And in order to do that, we would use degradable sutures to attach our scaffold to the torn ends of the ACL and use small bony tunnels to secure the sutures so that the scaffold does not move out of place.
Moving on to benefits and costs. First of all, there will be no donor site morbidity because we are not using an autograft. And in addition to this, we will not have to deal with any chance of tissue rejection like that in an allograft because we will be decellularizing the porcine ACL. Additionally, there should be reduced bone damage because we're using very small tunnels and avoiding the use of screws, allowing for easy recovery with reduced pain. Our implant will be biocompatible and have similar mechanical and structural properties to that of native tissue, and the seeded cells will induce growth and regeneration. Lastly, our procedure should have a reduced cost due to not having to harvest tissue from the patient, as well as a relatively cheap manufacturing process.
So the main competition to our method would be the ACL reconstructive surgery, but we previously mentioned the many issues that come with this surgery. So our method would have a better healing time specifically for the autograft since there isn't a secondary surgical site. It would also be less expensive to use a porcine ligament than it would be to get a tendon from a cadaver as used by an allograft. So another competitor would be the collagen scaffolds. So this is a tissue engineering option that's been used in the recent years to regenerate the ligament. So this method has had a lot of issues with surface integration. So it's often just stabilized through similar drill holes made for the reconstructive surgery as shown by the images on the right. So our method our method reduces the size of these bony tunnels and therefore reduces the issues associated with healing in the bone.
Thank you so much, and feel free to leave any questions in the comments.